Good day, nurses. NMC UK CVT 2023. Most common questions, Part 2. Question number 1. A new registered nurse has problems with making assumptions. Which part of the code should she focus to deliver fundamentals of care effectively? A. Promote safety. B. Prioritize people. C. Practice effectively. And letter D. Prioritize care. What is the answer? Letter B. Prioritize people. Question number 2. When a safeguarding incident is being disclosed, what action does a nurse take? A. Ensure them that you will not tell anyone else. B. Ensure you tape a conversation on mobile service. C. Pause the person until you can have another present person. D. Explain what you will do next with informations they disclose. What's the answer? Letter D. Explain what you will do next with the information they disclose. Question number 3. What is the management for moderation malnutrition in children? A. Document intake for 3 days. B. Supplementary nutrition. C. Immediate hospitalization. D. Weekly assessment. What's the answer? Letter B. Supplementary nutrition. Question number 4. When completing handwritten notes, which of the following represent best practice in documentation? A. Providing a signature, designation, and date of birth. B. Writing a name, nursing rank, and date. C. Providing a signature, printing a name designation, date, entry of time. D. Writing a name, designation, date, and time of entry. What is the answer? Letter C. Providing a signature, printing a name designation, date, entry of time. Question number 5. When a patient is being monitored in PACU, how frequently do you monitor his vital sign like BP, pulse rate, respiratory rate, and records? A. Every 15 minutes. B. Once an hour. C. Every 5 minutes. And letter D. Every 30 minutes. What is the answer? Letter C. Every 5 minutes. Question number 6. What is the normal urine output in a day? A. 2,500 to 3,000 ml. B. 1,000 to 1,500 ml. C. 2,000 to 2,500 ml. And letter D. 1,500 to 2,000 ml. What is the correct answer? Letter D. 1,500 to 2,000 ml. Question number 7. What is the average hourly urine production for an adult? A. 0 to 10 ml per hour. B. 100 to 200 ml per hour. Letter C. 20 to 30 ml per hour. And letter D. 30 to 60 ml per hour. What is the correct answer? Letter D. 30 to 60 ml per hour. Question number 8. What will the RN do after they have gotten an NMC pin? A. Orientation. B. Induction. C. Training. and letter D, endorsement. What is the answer? Letter B, induction. Question number 9. When a patient is having a surgery to switch from male to female, you need to teach a self-catheterization. What would you do? A. Get a doctor to teach as you are not competent. B. Read the notes. Letter C. Teach both male and female catheterization. And letter D. Discuss with patient what surgery he is undergoing and teach him. What is the correct answer? Letter C. Teach both male and female catheterization. Question number 10. Which one of these notifiable diseases need to be reported on a national level? A. Whooping cough. B. Influenza. Letter C. Chickenpox. And letter D. Tuberculosis. What is the correct answer? Letter D. Tuberculosis. Question number 11. What is the most accurate method to find out bleeding inside the brain? A. MRI. B. X-ray. Letter C. CT scan. And letter D. USG. What is the correct answer? Letter C. CT scan. Number 12. Lithium therapy is indicated for A. Tonic-clonic seizure. B. Schizophrenia. Letter C. Bipolar disorder. And letter D. Depression. What is the correct answer? Letter C. Bipolar disorder. Question number 13. What method of long-time feeding is appropriate for a patient with difficulty swallowing in a chronic condition? A. Parenteral feeding. Letter B. Gastrostomy. Letter C. IV. And letter D. NGT feeding. What is the correct answer? Letter B. Gastrostomy. Number 14. A client is conducting a research on 8 patients with complex needs. He wants to know their views on the healthcare they receive. What type of research is conducted? A. Qualitative research. B. Survey. Letter C. Patient questionnaire. And letter D. Focus group. What is the answer? Letter D. Focus group. Question number 15. Chemotherapy and the hormones waste disposal container. At what color? A. Yellow. B. Purple. C. Orange. And letter D. Black. What is the answer? Letter B. Purple. Number 16. The act of speaking out for people and relatives their decisions called A. Confrontation. B. Confidentiality. C. Advocacy. And letter D. Disclosure. What is the correct answer? Letter C. Advocacy. Question number 17. An obese patient with limited communication wants to lose weight. Who should the nurse involve? A. Physiotherapist and social worker. B. physiotherapist, nurse, GP dietitian. Letter C, occupational therapist, GP dietitian, and social worker. Letter D, occupation therapist, psychiatrist. What is your answer? Letter C, occupational therapist, GP dietitian, and social worker. Question number 18. When do you gain consent from a patient and consider it valid? A. Only before a clinical procedure. B. Only after a clinical procedure. Letter C. Only if a patient has the mental capacity to give consent. What is the answer? Letter C. Only if a patient has the mental capacity to give consent. Question number 19. What kind of medication should two nurses administer and monitor in the ward? A. Paracetamol. B. NSAIDs. C. Nifedipine. And letter D. Morphine. What is the answer? Letter D. Morphine. Number 20. The patient is for surgery, but the nurse suspects that consent is not valid because the patient does not have the mental capacity. What act? A. Mental Health Act. B. Health and Safety at Work Act. Letter C. Care Act. And letter D. Equality Act. What is the answer? Letter A. Mental Health Act. Thank you so much. Please comment down your score.